Now, Superdrug stores are known for selling products that can alter your look, well, when it comes to makeup anyway, but now it plans to go one step further than just makeup or hair colour. Customers can buy Botox for just £99, and after a consultation, over 25s can get Botox injected in a back room. And that has cosmetic surgeons pretty worried, apparently. Let's talk to best-selling author and broadcaster Kathy Lette, as well as Ashton Collins from Save Face, a National Register of Accredited Practitioners. Good to see you both. Kathy,
yes.
Should we be having, what is in effect, a poison available on the high street?
The botulinum bacteria. Well, first of all, I'm against the whole idea that women have to look young all the time.
Sure.
I mean, I think, you know, ageing to women is like kryptonite to Superman. You show me a woman who's happy with her age and I'll show you the electroconvulsive therapy scorch marks. And the trouble is that we suffer from facial prejudice. Women get judged on our looks in a way that men don't. I mean, for women, wordplay is foreplay. How else is Woody Allen still doing the horizontal tango? But for us, we get put out to career pasture, you know, once we get to about 50. 85% of people on British television over 50 are men. Women my age who have wrinkles are just kind of disappeared, vanished from life. So that's part of the problem. We just don't see enough women who look normal.
Yeah, absolutely.
What do you reckon, Ashley? Because I know, obviously, your organisation isn't against things like Botox, but thinks it's got to be more regulated.
Yeah, absolutely. I mean, these procedures can have great results as long as they're delivered by a safe pair of hands. So essentially, we only recommend that the public go to registered healthcare professionals for these treatments because they are medical treatments and they do carry risks and complications that can be permanent and disfiguring.
Is it worth getting uptight about a company like Superdrug doing this? Because, I mean, as I understand it now, pretty much anyone can buy and then deliver Botox.
Yes.
Yeah, absolutely. The landscape is that anybody can inject these treatments from anywhere. So the fact that they're now being offered on the high street isn't necessarily a new model. I think national chains have been doing it for a number of years and in department stores and things like that. But I think there needs to be some responsibility when you're talking about, you know, cheap prices and trivialising them into a point where, you know, they're not perceived as medical treatments. They're seen as an extension to a beauty treatment.
Yeah, like which is wax or a facial or
exactly,
something.
and that's when it starts to become dangerous, especially to millennials, you know, 18 to 25-year-olds who watch programmes like Love Island and Keeping Up with the Kardashians.
So are we seeing people of that age group? I mean, you must have... I mean, you chat to hundreds of people. You chat to anybody, Kathy, don't you, really?
The mouth and the south, yeah. But, hence all the laughter lines, you know.
But are we seeing young people
having
Botox?
I think it's absolutely right. It's to do with Instagram too.
Yeah.
Everyone trying to look like these perfect Barbie dolls, and not taking into account all the filters that are used, etc., etc. But there have been so many cowboy clinicians for a long time. Not just we're talking about getting it cheaply in Superdrug and places like that. I mean, sometimes you see people who've had their Botox and other cosmetic surgery, and you think, you know, their doctors couldn't put a dressing on a salad.
Yeah, and that's a real worry for us. I mean, last year we had 934 patient complaints, and the vast majority of those, 83%, were in the hands of people like beauticians and lame people that literally just decide to set themselves up as training providers.
Yes, it's not regulated. And, you know, if they're having it injected into their neck, for example, it's the botulism bacteria. It can paralyse their larynx and they stop breathing.
Yeah,
so, I mean, call me old-fashioned, but there's little point being beautiful if you're, like, you know, dead.
Yes,
don't you
absolutely.
Think?
Yeah.
So why can't men just learn to read between our lines? It's all there, the hours of fun and flirtation.
But is this men's fault in what they demand from women in this sense, or is it women actually because of all these TV shows and everything else?
Men aren't queuing up to have these procedures. Very few. No. It's the majority is for females.
The vast majority is women, but actually we've seen a huge surge in the number of men that actually use our site now to find a treatment provider, because I think these programmes put as much pressure on men now, I think, to look good as they do with younger women. But I think, you know, traditionally it's far more female-driven.
It's very stressful for those men. There must be some out there who don't have six-packs and pecs like the rest of us.
But see, women don't judge you on that. Every time they do research about what men and women find attractive in each other, women always put personality and sense of humour first and looks about 10th. And unfortunately, men always put looks first and personality way down. And of course, if you have Botox, it gives you a complete personality ectomy. It wipes your physiological slate clean. There are other ways ways to stay young. Dimmer switch, greatest beauty aid known to womankind. You keep the lights very, very low and just get much older friends. I find that helps. But I was going to tell you a story too about, you know, how ridiculous it is that we're all Botoxing our personalities away. Well, I'm not, but a friend of mine is a paediatrician in LA, and he said the babies were not hitting their developmental milestones, and he couldn't work out why. Was it the carcinogens in the environment, whatever? And I thought, it's the Botox, because when you've got a baby and you're going, I love you, little Bubby, and the mother's looking like that, and the baby's going, And when these women are Botox, they're going, I love you. The baby's going, So we're going to breed these stupid people because they're not having normal facial reactions. So
yeah, and I think there is an element to that with anything, that they can go too far and people can get addicted to these sorts of treatments.
Yeah.
And that's where the importance of the clinician comes into play, because, you know, if you are spotting signs of body dysmorphia, or people have got psychological issues that are perhaps making them, you know, more inclined to have treatments, then it's the practitioner's obligation, ethically and morally, to go, no, you're not suitable for this.
But is there also a point where, you know, they presumably got to hit, and it paralyses nerves, doesn't it? So presumably you've got to understand
Yes.
where everything is under the skin, rather than just shoving a needle in.
Yeah, it's a huge part, understanding where the muscles are, which ones to relax, and which ones obviously you wouldn't want to relax, because if you relax the wrong ones, you end up with a brow ptosis, which really is quite unattractive. It literally makes you look like you've had a stroke, because it pushes your sort of eyebrow down instead of raising them up or relaxing them. So it can have, you know, physical unattractive results if they're injected in the wrong hands.
So would you at any point, Kathy, support in terms of regulation?
Yes.
What Ashton's at? Because I mean, obviously you're against the thing per se.
Everyone on Twitter is going to be going, oh my God, does that woman need help? Send round the Botox truck immediately. You know, how tragic. But yes, it does need to be more regulated, absolutely. I mean, and as we were talking earlier about all those cowboy clinicians, I mean, I've seen some terrible things that have gone wrong with women's faces, and just even in Harley Street and places like that.
Yeah.
So it's much more dangerous and much more perilous than people actually admit. It's not a casual thing.
Yeah, we're seeing a huge rise in cowboy practitioners. We're literally, you know, one example was one guy was a air steward, and he decided he wanted to be a treatment provider. So he set himself up a clinic in his shed, ordered products over the internet, and started injecting people 2 days later.
You're joking.
And that is becoming increasingly popular.
But to bring this back, though, to the concern of it being on the high street and through Superdrug, presumably you know, it's a big company, it's a well-respected company. Presumably, it is going to have properly trained clinicians administering this.
Well, they're saying nurses. But
yes, from what I've read, they are having properly trained nurses that are, you know, placing a heavy focus on the consultation, which is really positive. But I think it's just key in terms of how they communicate the treatments. And, you know, yes, price is a contributing factor, but it shouldn't be the catalyst as to why you should choose somebody.
What I would say to women is you'd be much more beautiful if you read a book now and then. And also, why would you want a man who only wants you because you're full of Botox and silicone from tonsils to toenail? You wouldn't want a man like that, because obviously he's shallow and heartless and callous.
But whether people want to make these slight improvements or not, the bottom line is all of us, men and women, Kathy, let me point out, we've all got to learn how to age at some point, haven't we?
Yes, and age... I was going to say gracefully, but disgracefully in my case. I'm always swinging off a chandelier with a toy boy between my teeth. So, yes, and I just think it's really about personality. I mean, of course, beauty is a diminishing asset, whereas wit can get sharper and sharper and better and better. So read, go to art galleries, you know, chat to people, grow your brain. And also the best way to stay young is actually laughter and great sex, because both those things lower your stress hormone and they boost your immune system. So that's my top tip to you tonight.
That's where I'm going wrong, ladies. Thank you both very much indeed. Good to see you.